Call the Cuyahoga County Health and Human Services Aging Committee to order at 1:03 p.m. I'll start. Clerk, can you call the roll, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell. Ms. Conwell is absent. Mr. Sweeney is absent. Mr. Castleberry?
Here.
Ms. Fluffer?
Here.
Mr. Hauser?
Here.
You have a quorum, and let the record reflect that Council President Miller is also in attendance.
Thank you, Clerk. Do we have anyone sign up for public comment this afternoon?
Yes, we do. Lou?
Thank you. Welcome, Lou.
Wow, good afternoon, everybody. I'm glad I'm here again. Right now, unfortunately, this year we know it's a state biennial budget seasons. So there are lots of things I need to catch up with all of you. If possible, please give me the extra minutes so we go back to 3 minutes. I wish I have a permission for that, just in case I go over 2 minutes. Thank you. Okay, right now the state budget is putting all of us in trouble because county does not have the full resources to meet the needs. And unfortunately, the state legislation will actually cut off lots of things. So let's talk about even without state budgets hurt to us. I will give you the most recent report on the health. The so-called elevator installed, we have tried that for 2 weeks. But guess what? Even first week, as I predicted, even last year, probably Mr. Hauser, you can imagine that. I did that last year already multiple times. I said people will get stuck in the elevator maybe overnight or over the weekend. Fortunately, the 3 incidents I know of during the first week, they happened during the daytime, so people got rescued. However, just within the 2 days, we had a power outage because the construction inside of the building caused that, not on purpose. However, the staff actually refused to make an announcement to the people and let people use the stairway. And I was physically threatened, all right? And I had to call YWCA about that. And it seems like these workers, YWCA still cannot really understand all these miscommunication. That's because all these staff in charge, not all of them really care about the people. They may not report the true issue. So I had to raise the voice to tell them that the staff in charge actually refused to make announcement. So people all got stuck on the second floor and the first floor. They could not go to the other floor either to eat or to retrieve their personal item for whatever activity they need to go to. And this is a fire safety issue. You cannot have an elevator but without a stairway. All the building, including this one, we have elevators, we also have a stairway for that reason. Please advise the service provider to actually re-educate their staff. Do not mistreat the unhoused. Stay in there. Thank you.
And thank you for your comments, Lou. Appreciate that. Next, can I have a motion for approval of the minutes of the previous session of this committee?
So moved.
Second.
A motion and a second. All in favor?
Aye.
Opposed? The ayes have it. This afternoon, we do not have any new matters to be referred to the committee, but we do have two presentations. And
The first presentation is Rochelle Milner, Executive Director of Westside Community House.
thank you. Welcome.
Taller. Good afternoon. Good afternoon. I am Rochelle Milner, Executive Director of the Westside Community House. It is a privilege to be before you today. It's been a while, and I'm really grateful. I'm here to present on our process for the ARPA funds that we received to do our strategic plan. And any of you, I'm sure you've been through a strategic planning process, and you know it is a whirlwind. I liken it to riding a roller coaster. When you're waiting in line for 2 hours, you're kind of anticipating, and I know from my personal experience, I was saying, yeah, I'm going to do it. Maybe I won't do it. I think I can do it, but I don't know what my friends will say. How are they going to, think if I don't do it? And then after you wait for 2 hours, you get to the front of the line, and then there's more pressure because now you see the people getting off and your heart's just beating. And as you get on that roller coaster and you pull that safety guard down, there's no turning back. I liken that to the strategic planning process because we know even as you go up the hill and it's click, click, clicking, there's no turning back. And you know there's going to be some ups, some downs. Your stomach's going to be in your chest. There's going to be some whirlwinds and all these different things. And I liken that to the strategic planning process. All the ups, all the downs, all the nervousness. What are people going to think? And for me in my seat, are my staff going to receive it? Do they want to do it? And et cetera, et cetera. Diana Rose, the consulting firm, was the one who led us through our process. And she is amazing at what she does. When we went through our process, there were several things that were very key for us. One was setting up a strategic a task force to lead us in the strategic plan. This task force led the process, and it was derived of staff, board members, as well as leaders and management. And that's so important because our last plan was completed in 2010. So imagine all of that time. And during that time, the last plan was to get the previous director, for her to be able to retire and then do a transition plan, which got me in my role. So in between there, the pandemic happened and everything. And so now we were well overdue for a new strategic plan. Westside Community House is 135 years old. And so that's very, very important for us to be able to sustain in the community. Settlement houses we're doing a lot of great work, but we need strategic planning to be able to go forward and to remain in the community because there's a lot happening, as you guys already know. So to take you through a time frame, in October of 2023, we started the Strategic Planning Task Force, and we did an assessment of the current in-house environment. We looked at our organizational capacity and our competitors. In November of 2023, we reviewed our mission, vision, and values. Let me pause and also say that I had to do some work with the staff beforehand and say, okay, guys, we're going to do this strategic plan, and this thing is not going on the shelf. Also, it won't just be me involved with this and the board, that they would also be involved. So a lot of priming took place to get them prepared. And we have a lot of staff people who've been at the organization for many years, some for 40 years, 34 years. So change management was a big thing that we had to engage with. In January of 2024, it was one of my favorite parts where we engaged the community in doing interviews and focus groups and really getting them as the expert to come to us and say, this is what we think you need and how we think you need to maneuver in the next 20 years. In March of 2024, we created goals and success measures for the next 3 years. And in May, we developed our growth strategies that were required for funding. In June, we finalized the plan, and in August, we had our community launch. So let me talk a little bit how we engaged the community. We met with 128 people through focus groups and interviews. With the focus groups, we had 87 participants, 14 staff, 35 seniors, 20 adults, and 18 youth. In the interviews, we did 19 people, 1 from executive leadership, 4 board members, 6 community partners, and 8 stakeholders. So you can see the well-rounded viewpoint that we were able to receive for feedback for our strategic plan. So the way forward, I have presented here our one-pager for the people in our audience to see today. We came up with 5 implementation areas, which are build, enhance, amplify, sustain, and create. The beautiful thing about these content areas is that we went to staff and asked them to identify where their skills, talents, and gifts would be able to be lended to each area in this process. So we have staff people that are comprised of teams as well as board members that will work on each of these areas. So the build is to build organizational capacity and improve operations. Enhance, we would like to enhance and develop innovative programming for the organization. Amplify is to amplify our community presence. We used to be located on 30th and Bridge, and in 2006, we moved to our current location. And for those who were attending in Bridge, they knew the Westside Community House. It was the community center. People stopped by on their way after school to play basketball or do after-school activities and et cetera. However, in the new building, people more so came to us based on a reason. And we want to get back to our roots of being that community center. Sustain by way of growing and diversifying our funding sources and create a great and useful space. Our building is almost 20 years old, so you can imagine it's time for all the repairs. So our current mission that we came out of the strategic plan is to be a resource and support to our community by providing innovative programming and strong partnerships through cultural humility. Our vision is lives are transformed for sustainable community growth. Our values are relationships, compassion, acceptance, integrity, and growth. Now I wanted to talk about the funding that we utilize for our strategic plan. We were awarded $50,000. We expended $39,192.93. The balance to the funding that we received is $10,807.07. So the reason why we underspent is because we did not get to go offsite to do like staff and board retreats as we had planned. And a lot of those things occurred in-house. So that's one of the reasons. And then we also didn't get a chance to print the actual documents to give out the glossy, really high profile copies of the strategic plan. The reason for that is that we had one of our key staff members who became ill and wasn't available to do a lot of the work. So there goes that roller coaster, right? So the proposal that we would like to make for utilizing the remaining dollars is that we would be able to print those documents, and as well for further implementation, which we are working with Diana Rosa and her team for implementation by way of meetings, and maybe we can have that staff retreat and the board retreat now as we move forward. So in conclusion, I just would like to further reiterate the roller coaster analogy and just saying that now, when you get off the roller coaster, it was so much fun. You're so glad you did it. However, you're thinking about the next one you want to ride, and that's where we are. As we implement the strategic plan, I'm back at the beginning. I'm in line again. So I'm really excited, like I said, about working with Diana Rosa and implementing this plan that we, want to be able to diversify our funding sources. That's the main thing we're going to be doing. And we have identified a firm that we will work with as far as development, because that's another hat that I wear, but I can't do it all. And so we're going to be looking at doing a capital campaign. So now we're looking at the people who help build the building and establishing those relationships, as well as diversifying our funding sources. So that's our strategic plan. I hope I didn't go too fast. And let me know if you have any questions.
Well, thank you, Ms. Milner. I appreciate the presentation, your enthusiasm for the work you do. And I'm going to at this time open up to see if any of my colleagues have any questions or concerns. Mr. Slepper, I knew you always have some insightful questions, right? I knew I was turning to you first.
Thank you so much for being here, Ms. Milner. We really appreciate it. I'm familiar with the work of your organization, and it's incredibly transformative, so thank you so much. Could you just kind of share, just from a 10,000-foot perspective, is there one particular population or one particular space where you serve the most people? Is it with youth? Is it with, seniors in the community? I'm always curious kind of where most of your resources are pointing.
Sure, sure. Our Healthy Aging Center is where we serve the most participants. Even as you think about our interviews and things, there were 35 seniors that participated with that to lend their expertise and their experience. And it is so much so that, we have been providing this service for so long, and that's one of the first areas that we're exploring how we're going to better serve them in the community to meet their needs.
Thank you. I believe Council President Miller has a question.
Yes, Mr. Chairman, Director Milner, thank you very much for coming down and for all the great work you've done over many years. And my question is whether the West Side Community House provides any residential services. Do we have any people that actually live there, or is it all in terms of other kinds of services?
It is in terms of other kinds of services, although I think I live there sometimes. No, we do not provide, but for families in the community, we may give them resources as far as where to find affordable housing and et cetera.
Okay, thank you.
Thank you. Mr. Hauser.
Through the chair to the director. Director, how is the West Side Community House measuring success, and is there any early indicators on your new strategic plan?
Sure. So how we measure success are through our funders and the reports that we complete for them. And as a part of our strategic planning, we are evaluating how we can improve that, because it's one thing to tell the funder story, but in order to tell your own story is very important. So that's a part of our sustainability growth strategy, and we're looking at how to further do that, to tell our story.
And then my next question, it looks like the project is marked as completed through September of this year due to remaining funds. What additional activities or enhancements do you guys have planned for this extended period?
Sure. So we would like to get the strategic plan printed. That's one activity that we would like to do. And then as we work with Diana Rosa and her team, we would like to work on strategic plan implementation by way of meetings with the staff and possibly doing a retreat with the board and staff. So it's the project planning and management that we would contribute to that was not attributed to the existing plan.
Last question. What were the primary community needs that you guys identified that went into this strategic plan?
Oh, sure. Community needs are housing, mental health services, and services for our aging population, for access to health care and just ongoing support as we see it.
Appreciate it. Thank you, Director.
Thank you, Mr. Hauser. And Director Milner, thank you very much for your presentation. Appreciate the work that you're doing for the community, and hope that can continue. And again, thank you for all the information you provided this afternoon.
Thank you. Have a good day.
Our next presentation, June E. Taylor, Chief Strategy and Philanthropy, and Mr. Myron Bennett, Manager of Strategy and Performance of the Western Reserve Area Agency on Aging.
Welcome today.
Good afternoon, Mr. Chairman. Good afternoon, Council President Miller. Good afternoon, Councilmember Slepper, as well as Councilmember Hauser. Thank you so much for your time. We are honored to be here today to give you an update on the Nails It program, the Western Reserve Area Agency on Aging.
Excuse me, Ms. Taylor, can you just state your name for the record, please?
Oh, my name is June E. Taylor. I'm the Chief of Strategy and Philanthropy.
My name is Myron Bennett, Manager.
Thank you.
Okay, thank you. We are here to provide an update on the Nails It strategy that has been supported by Cuyahoga County Council. We are very fortunate to have received funding, and we wanted to provide an update on where things stand and the work that has been done to date. As you may already know, The Western Reserve Area Agency on Aging's competency is focused on seniors and individuals that have challenges. Many of those challenges are physical, but our main objective as an organization is to keep seniors and their families safe and to provide safety and independence in a place that they feel good about, which is typically their homes, and to live independently. So we have a very brief PowerPoint as well as some real live video examples to share with you today. And at this time, if there are no questions, we'll proceed. Thank you.
Please feel free to proceed with the presentation. Thank you.
Okay, thank you. First slide, please. Next slide, please. Oh, we have control?
Yeah.
Okay, great. Okay, thank you. So one of the first things I want to talk about is everyone thinks about death and disability as it relates to heart disease. If you ask anyone what's the #1 cause of death, it's heart disease, or mortality or morbidity is heart disease. People always think about cancer also, but I don't think many people know that the #2 cause of morbidity and mortality for seniors is related to falls. And so as a result of that, that's one of the reasons why our director, our chief June Taylor, developed this program, which we call the Nails It program. And one of the reasons we called it Nails It is that most of the modifications that are involved in this project involve just some basic home modifications. We're not talking about extensive modification. We're talking about things that keep people from falling in their homes. So we're talking about things such as grab bars, handrails, showers, ADA showers, wheelchair ramps, ADA toilets, and easy-to-open ADA windows. To date, in Cuyahoga County, we have completed 269 of those projects with a variety of types of projects. We've completed 80 grab bars, 58 handrails, 46 showers, 31 wheelchair ramps, 48 ADA toilets, and 6 window installations. Next slide, please. And so, the next slide will tell you or show you kind of the breakdown as it relates to where these projects are taking place. Of course, the city of Cleveland, being the largest metropolitan area in the county, has one of the largest number of modifications. But we do have a lot of modifications taking place in the ring suburbs. We're starting to note that there are a lot of aging citizens in those areas. In addition, their homes are at that point now where they need some sort of modifications. A lot of the housing is aging, and as a result, there's a lot of fall hazards in the homes. Stairs that people need to walk up and down just to get in and up to their bedrooms or up to their bathrooms. So we're starting to get a lot of calls for that. We've also noted that a lot of seniors need wheelchair ramps. It's getting to that point now where mobility is becoming a problem. And as our population ages and as people are living longer, we're starting to note that there's a need for those kinds of modifications in homes.
This slide shows projects by neighborhood. We thought it really pertinent to kind of show you the variety of projects and where they are. Other neighborhoods encompasses many of those suburbs that Myron just mentioned, but this also gives you our total spend as of March. I'm sorry, our dates have not caught up yet to May, but we will have an update that we will follow up on. But we are keeping up with the number of requests. And I have to tell you that it has been a challenge internally from an operations standpoint. We're getting a lot of phone calls, and then also because of the winter, that slowed us down in our ability to be able to be as expedient as we wanted to in terms of the installations. But this lets you see the brevity of the actual projects.
One of the things that one of the purposes of this project was not only to design fall prevention activities within homes, but also to provide employment for individuals who live in Cuyahoga County. So what we've been able to do is identify about 10 different contractors, small businesses, people who suffered through COVID because, you know, there were a lot of people didn't have business. But we were able to identify 10 small businesses that have benefited from this. In addition, all of the products that are used and purchased are manufactured here in Ohio. So we've also deemed this as a jobs project. One of the next phases of this project we're hoping to involve youth and have some sort of youth training component to this. Because a lot of these repairs are simple repairs, but this will be a great avenue for youth to get involved in the trades.
This slide also shows the number of phone calls. It is a very intensive process. I have to say, if you were to ask us what have some of the challenges been, as you know, we're in the business of Medicaid. We receive quite a number of phone calls related to our core business, which is to distribute our social workers out to the areas to get the good work that they get done. But it was through COVID that our social workers encountered the falls and safety issues as they were going into the homes. So we wanted to also show you in terms of, you know, just really inquiry distribution, we receive so many calls now for please for help with people wanting to remain in their homes. The next slide kind of shows you the zip codes in terms of volume. This volume, because it's spring now, it is increasing on a daily basis. We are keeping these metrics as well so that we can report back to you where these calls are coming from and the various concentrations. But I think overall, I think it's important for the council to know that we are receiving calls from all over the county. We really, really are, and we're doing our best to service and assist every citizen that we possibly can. As you know, many times we're talking to the citizen about their home, and then that leads a phone call talking about their food, and that leads a phone call talking about their medicine. We've had to internally work to get some support to help some of our seniors who in fact are also lonely. We've encountered that as well, and they're so glad to talk to a live person, not AI or a push-button service. So we have some employees who like to talk a lot, and that's where they've been assigned. Okay. That really concludes the sort of paper point at this time. We have a short video to show you live, because it's one thing to hear it, but it's another to see it. And I think our team here can cue that up, and we will, of course, answer any questions.
My name is Irene. Everybody was shocked to say, oh, you got railings now. Yeah, one going upstairs and one going downstairs to the back door landing. I feel safer with the railing, and so far so good. And everything they did, I needed it. And my husband and I was going to do it, but he passed away before we could get around to some of all of this, you know. The angels gave me railings. I always give thanks to him first.
Basically, it's my first time out since the winter. When I get out and go to the backyard, I still get out, go to the store. My daughter will come down with me and we'll ride down to the store and get my lottery tickets. I served on a Navy ship, the USS Cunningham, DDG-17, and I'm a plank owner on that ship, original crew member. Put her in commission in '63.
We had been calling around to see if there was any assistance, you know, we could have for the ramp. And I had called Western Reserve, and at the time, nothing was available. But you contacted me after that and said you had gotten a grant at that point, and would he be willing to be the first recipient? And we said, absolutely, absolutely. So that was really, it was a godsend for us.
I said it's been wonderful having this ramp so he can get out. My brother and I and his aides have been able to take him down to the corner Dairy Deli, where Billy and his family own, for him to buy his lottery tickets. He comes in the backyard to sit with my mom, who's his high school sweetheart, so they could really enjoy their time together. Outside of that, I mean, he was seriously a prisoner in that house. He could not get him out. We took him out as long as we could, but when he could no longer walk, we just could not get him down these stairs. You see how difficult they are. And then from in the house, there's 3 steps down to that landing, Mom, right? And then another step into the garage. And the basement steps are right across from it, so not very safe. So it's really been a godsend, and we are forever grateful that this opportunity was provided for my father and for the family.
My name is Pralitha Taylor, and I started experiencing a lot of problems getting in and out the tub. I had a knee surgery replacement, total knee surgery replacement in February 2024. And I decided to look around and try to get prices on a walk-in shower. I couldn't believe what they was asking. They didn't only want to just do the walk-in shower. They wanted to have my whole bathroom, redo my total bathroom. And the price was totally ridiculous. But that's why I was constantly looking. But once Western Reserve came in, I said, hey, this is my blessing, and I took it. And I'm very happy that I did. It was a lot of work. I was afraid because I had tile all over my bathroom. They had stone tile, and I didn't want to get rid of it, but they were so great with doing the work. When they put my walk-in shower in, they also took some of my stone and put it around my tub, which made it look more elegant to me than just a shower. I enjoyed that shower so much. I never thought I would have a walk-in shower in my bathroom, but now I wish I would have done it much sooner. I like the material that they purchased for the bathroom, very good material. And the grab bars are really awesome in the way they are. I like the pull-down shower head, and that's a big help because I can sit on a bath stool and still shower. So I'm very pleased, very excited, and I wish everyone could have that fantastic experience that I have.
So thank you so much for your time, and we can, of course, try to answer any questions that you may have.
Great,
Yes,
absolutely.
A couple more things.
For
I
sure.
just want to let you know, Mrs. Turnstein is 95 years old. And she still walks up and down those stairs. She literally was crawling up those stairs before we installed her handrails. Mr. Kupowitz had not left his home since, he said, Halloween of last year. And they were actually getting ready to sign him up for hospice because they thought, because he wouldn't wake up, he didn't have any motivation to do anything. That day, when and his daughter talked about going to get his lottery tickets, he took off in that wheelchair, and he came back like an hour later. We didn't know where he was. We were worried about him. And then Mrs. Taylor, she said that the estimates for that shower that were coming in were between $8,000 and $10,000. And so, these projects have immediate impact on people's lives.
Thank you. That was exactly what I was going to say about the impact on people's lives. You're giving people their mobility back, which is key. And again, like you said, this gentleman was gave him a whole new lease on life. I really love the program. I like to see that you're buying the products made in Ohio. We're using local contractors. That was one of my first questions. I was wondering who was doing these installations, because even these, they have to be done correctly too, to provide safety. But I was wondering, so the seniors that are calling you, are they usually typically people that are already using your other services, or this just, how's the word getting out to them that this program's available to them?
I think that what we've tried to do, and our CEO, Dr. E. Douglas Beach, we have to give him credit for using every tool to get the word out. We have partnered with newsletters. We've partnered with newspapers. Some of your traditional sort of methods, because many of our clients are still not, I'll say, social media savvy or tech savvy. We have gone out to the communities, and so we kind of have a road show because we do have a community initiatives department. We go to the malls, everywhere where there's an opportunity, where there's a senior open house or festival or community event. We're there with a table and we're getting the word out. So I'll say, by mouth, by TV interview, radio, AM 1100, as well as newspaper, and then our website as well. And we're pleased, Mr. Chairman, because the volume is huge.
Yeah, no, that's great. I was wondering if some of the local senior centers that are in some of the communities are aware.
Yes.
And, these repairs can be expensive, especially for someone on a fixed income. But are they income-based as well? So if someone reaches out to you, do they have to provide some income information?
The project was originally designed for low and middle income. And so a lot of the programs that you have with the CDCs are low income. But what we were noting is that a lot of people call us and they have high medication costs, they have high medical costs. So they may have, reasonable income, but their external other costs, kind of prohibits them from. So some people get great retirements, but then, who's got $10,000 to put into a shower?
Exactly.
Or, $15,000 to put into a wheelchair ramp. So yes, we've been looking at that middle income, and that middle income is flexible. Again, it depends on where it's more need-based than it is income-based.
Understood. And, well, I appreciate, like I said, the work you're doing. You're helping seniors stay in their houses longer and safer. And when you said that gentleman was 95, I'm going to tell you one quick story. To my surprise, I knocked on a door in Parma at one time, and the lady came down the stairs. She was 103 years old that answered the door. I felt so bad for making her come. She goes, "No, I do it all the time." I said, "Well, I would have come to the front door had I known you were going to." I thought her daughter was going to answer. So it's good to see people sticking around a lot longer and staying in their homes. And I'm going to open up to my colleagues to see if they have any questions or comments. Mr. Slepper.
Hi there. Thank you both so much for being here. This work is so critical because I think it touches everyone, right? Everybody in this room has had or been touched by an aging parent or perhaps an aging spouse. And how do we navigate that? I'm navigating that space right now. My mother's had a lot of health issues in the last year. So, how do you, kind of unpack all the different pieces of what it means to stay in a home, if you can stay in your home or otherwise? So my question is, from an accessibility standpoint, you were talking about some of your marketing issues and things like, or, marketing pieces that you're doing. What's the turnaround time? So if someone gets matched or approved for a particular project, right? Let's say, they're getting a new walk-in shower in their home. Do we work with them directly through that entire life cycle of the project, or is it more of the agency is doing it, or is the contractor the direct point of contact for them?
So we are the point of contact. And so the original call comes into us. We determine whether it's a project that we can do, because we get a lot of calls also for hot water heaters and things and other things, roofs. And so what we do is we also refer people to those programs. And so we have partnerships with community development corporations, municipalities, other agencies on aging, senior centers, and they may have a program in their community. So once we triage that, then we identify the contractor from our list. Well, first of all, we go out and do the assessment. We have a person who goes out and does the assessment, and then they fill out the application with the resident. Then they identify the contractor. The contractor works directly with the resident, and then after the completion of the project, we go out and we evaluate the quality of the project, and then we have the resident sign off that they're satisfied with the completion of the project. So if for example, Ms. Taylor one of the things she wanted at the end of her project is she had those stone tiles that you saw. She said, you know what, I really want those back up. And so we said to the contractor, you got to come back out and finish the job. For Mrs. Taylor, for someone else, they may not have wanted that, but for her specifically, we took that step to make certain that she was pleased at the end so she could sign off on that project.
I think it's important to also note that our finance team, we have a Chief Financial Officer, Chris Hall, who has a very labor-intensive verification process for the contractors. We are hypersensitive as an organization regarding scams and all sorts of things that come to people's cell phones. And so we are very communicative about the contracting process first has to go through our organization for licensing, bonding, background check, et cetera. We have identification and badges on our contractors too, so when they come to the home, they are part of our family and so forth. And then also making certain that all communications are most likely in person. We're not going to be on the phone telling you prices are going up and all that sort of thing. This is a very detailed one-on-one in-person process. Now, yes, that's more time, but thus far, we have been a very safe and non-scammed organization with regard to this program.
Thank you so much. That was probably the most comprehensive response I've ever gotten to a question, so thank you so much. But it's incredibly heartwarming, too, because these are simple, in many cases, operational transactions for folks, but it really can change their lives.
Yes.
The ability to stay in their home and really just the economic pieces of that as well, not only for them, but even just, the public good. So thank you so much for everything that you're doing. We really appreciate it.
Thank you. Great question, Councilman Schlepper. It did lead, I was actually thought about the background checks and all that, and that was a comprehensive answer. I know Councilman Hauser has a question or comments.
Sure. Yeah, so to the chair, to the chief, to Councilman Schlepper's point, we all know someone in the aging community. My mother is 74, my grandmother is 96. We reached out to multiple organizations to get her rails because she was crawling up her stairs. We were not able to get her approved, and so we kind of just went over there as a family and actually drilled the holders up her stairs ourselves. I guess my question is, you guys are doing great work. I'd be interested, how much was the total funding for this project from the council? I see you guys have spent $178,000. You guys remember the total amount you were rewarded?
So this was part of a larger grant, which was 2.1.
Okay.
2.1 was for food insecurity, was 400,000.
Yeah.
210,000 was for transportation, and then the additional 1.3 was for this project. And so we're still doing the spin down. And again, part of our delays were related to just finding 10 contractors.
To go through, to make it through that process.
Because a lot of contractors closed business during COVID. And so a lot of people are ramping back up again. We also started working with community development corporations, and they had turnover as a result of COVID also. They also have programs that are very similar, and so we thought we would work with them because they already have the process set up. And so we are working diligently to spend that money down. Just to let you know, in the last 2.5 weeks to 3 weeks, we have had 200 calls through the queue. And so, that's one of the other delays is that we have a person that he's answering the calls, he's
doing assessments.
He's doing assessments, he's doing completion of projects, and so those are some of the delays, related to getting the project moving forward. But every day, someone's getting some work done. 3 to 4 to 5 people are getting work done simultaneously. Because again, we have ample number of contractors.
Great. Yeah, that you answered one of my questions. We got to get him some help if he's doing.
That's something that we're gonna we'll be talking about that. And also, if you mentioned that you weren't able to get any assistance. Your mom and your grandmother in the future, please give us a call. I don't know if you called us, but give us a call, and we'll make certain that if there's anything they need, you can probably identify something right now that they need. So make sure that you give us a call, and we'll make certain we'll get someone out.
I appreciate that. And yeah, that was because I'm sure the 269 completed projects, I'm sure they are extremely happy. And I guess I was just wondering, we have a huge aging population here in Cuyahoga County, and so how can we up that number? All of us are going to be the Asian community one day, and so how can we up that number? Where are you guys getting other funding from, if you don't mind me asking? Where's your different
Sure,
funding
on the
sources?
federal level, we have received some funding, and then more recently, we have been in discussions with some of our area banks as well. So we're looking at, and in philanthropy, we're looking at some private foundations, of which our region is very rich with, but that's why we're also keeping good statistics as well, because we'll have to be able to share the metrics as well. But we're open.
And then I just last questions. Any key initiatives you guys have started or worked on? I heard of the great works from the different home improvements, but any other initiatives you guys have done? I know you mentioned transportation and what?
Yes. We hope to give you an update at the end of the summer regarding our transportation initiative, which is 2 ADA 12-passenger vans, which the county appropriated funds for, which we received, which are going to work in concert with Case Western's dental school and the dental community engagement initiative, whereby seniors will be able to utilize the vans for their dental work, as well as their family will be able to go there for dental work, and to go to neighboring markets for food as well.
Excellent. How do you guys identify who gets services and who doesn't, or is it just based on capacity for the organization? If two people call at the same time who needs a roof, how do you guys decide?
This is a everyone gets served project. The only people that we can't directly serve are ones that are outside of the scope of what our project entails. So I mentioned earlier, we were getting a lot of calls for roofs, for hot water heaters, furnaces,
Air conditioning.
things like that. So those are the only things that aren't covered under the purview of our grant.
And then very last question. I know you mentioned it before. What were some of the key lessons learned from doing this work over time? Like what things have hindered, or what are you guys trying to do better in the future to make sure this process is more accessible and smoother?
Yeah, I'll just name, I think we'll both come up with two. On the executive side, where I sit, from a strategic planning standpoint, we thought we planned well, but due to the phone calls and the actual, I will say, just the breadth of needs of the community at this time, internally, our structure was not prepared for the onslaught of phone calls. We already received so many calls regarding doctor's appointments, doctor bills, invoices, social worker appointments. That is our core organization, right? But then now we have a whole nother pillar related to, home modification that's getting just as many phone calls. And that's not what we, from a organization, are in the business of doing, but it was a result of COVID. You might be familiar with the Great Grocery Giveaway. We were the first organization to do the Great Grocery Giveaway in a partnership with Dave's Markets and the gift cards and all that sort of thing. It was one thing to deliver the food, but it was another that we couldn't get in the house. Or we were like, is there somebody here? Well, it was just taking our citizens so long to get to the door because they're super agers. And so I have to say, Councilmember Hauser, that organizationally, those are two examples that I can cite. And so we are going to do some infrastructure upgrades with our phone system. We're going to also integrate some volunteers to help with this program. And we're also going to have people who have benefited from the program become spokespeople for the program. They're our best advertisers.
And one of the big lessons learned, we actually met with Councilwoman Conwell a couple of weeks ago, and she shared with us that you have a robust IT team that's helped us with heat mapping a lot of the calls, where the calls are coming from, so that we can cluster. Because what happens is that, say for example, you have 50 calls, and you're answering them in the order they come in. What's happening now is we're looking at the clusters of the calls so that we can disperse the teams to those areas, instead of people going, you know, this side of town, that side of town, this side of town, this side. So now what we can do is assign teams to actual areas. And so that allows us to make certain that we can expedite, you know, the process of getting someone into a house and getting the work done.
Well, thank you so much. Thank you for all the work you do. And I was just using my mother and grandmother as examples. That they're going to be fine, but we have a lot of seniors who would benefit from you guys' work. So if you need anything from us, please let us know.
Thank you so much for your time.
Great, thank you. And Council President Miller.
Thank you very much. And my question is whether you expect to be able to continue this program using other funding sources, or when this grant money runs out, is this going to be the end of it?
Thank you so much, Council President, for that question. In preparation for, I would say to you, uncertain times that we seem to find ourselves in right now, we are networking and having conversations with philanthropy. There are some organizations that have heard our discussions on the radio and so forth and have asked us to come in and present. So we're pursuing philanthropy. We are also going to pursue high net worth individuals that are very passionate about this space and this sector in terms of donations. And we also are plan to appeal to the state as well, and anyone that's willing to listen about this work, because we feel confident about our track record now. We have something. I think it's one thing to say what you're going to do, but I think now that we've done it, we have a proof of concept. We've demonstrated capability and competency as well, and we hope that these outside sources will come on board and complement the work that the county has supported us with, sir.
So thank you very much for that report, and it's clear that your program is working, and I wish you the best of success.
Thank you, sir. Thank you, everyone.
Thank you. And I do want to add, as you were saying, that as you're calling them pillars, this wasn't the original intent of your organization, but I'm really glad that you guys are doing these home modifications. And in my prior experience as councilman, people would call and they couldn't get seniors, they couldn't get people to come out for small jobs. And I've heard that over and over. So you guys have not only found the contractors, background checks, you're doing the work and changing these people's lives. So I'm really glad to hear that, and we'll do what we can to support you. And I really thank you, Ms. Taylor, Mr. Bennett, for being here and making your presentations, letting us know about what the great work you're doing with the Nails It program.
Thank you so much, everyone, for your support as well and your time.
At this time, do we have any miscellaneous business? I think we covered a lot. We heard about two great organizations and the good work they're doing. So with that being said, this meeting will be adjourned.